Hello, my name is Lisa Rogers, and I'm going to show you the proper way to give insulin injection. And first of all, I want to start by telling you what diabetes mellitus is. It's a disease that affects mainly older cats and overweight cats. The clinical signs of it are increased urination, excessive thirst, inappropriate voiding. They might start going outside the litter box. They will be really hungry and eat, but then they will lose weight. That's some of the signs of it. It is a manageable disease. The disease is caused by the body not producing the correct amount of insulin. So that's what causes the problem. So we need to supplement the insulin by giving the insulin shots. And first of all, show you that the medicine, this is Tigger. She is a diabetic. She's been a diabetic for several years now. My mother and I both give her the injections. She gets the Humulin N insulin. It has to be kept in the refrigerator. And it's okay. I'm going to show you the type of syringes that are used to give her her injections. There are only two types of insulin. I'm forgetting the word. Syringes that you use, A40 and A100, and this is the A100. What you do is you're going to twist off the top, a little cap on the top, and you want to move the insulin around a little bit to stir it up to make sure that it's evenly distributed. Then you're going to take the cap off of your needle and invert the insulin, put it in here like this, and pull out the amount. And Tigger usually gets 1.5 insulin units in the morning and 2 units of insulin at night. So she's not quite ready for her dose yet. She's still got a couple hours, but I'm going to go ahead and draw up her 2 milliliters here. Okay, and that will be ready for her dose. And you want to cap the needle by putting it down. And then once the needle's inside, then you can cap it. But what we do, the way you want to give the injections are, there's a couple different sites that you can use to give. There's the flank area, which is back in this area here. That's what area she gets it in. And you always want to give insulin with food. She doesn't get her, if they don't eat and you give them insulin, their sugar is going to drop way too low. So you want to make sure you do it with a meal. She gets them every 12 hours. And it's really important to keep a log of when you gave the shot, the date, the time, and the units that you gave. If you don't do this, you're going to forget and everything is going to get mixed up, and you don't want to do that because you can make your cat really sick if you don't keep the dose consistent as the vet ordered. And also, you need to have regular visits with your DVM to get the sugar checked because they have to adjust it a lot of times. So that's another thing. But you can also give the injections in the side of the stomach. But like I said, what we do with Tigger is we will give her food, usually up on the bed or something. And while she's eating and not paying attention, we'll go ahead and inject back here in this flank area. And she's pretty much used to it. Every once in a while she'll cry a little bit and meow when we do it, but she's really used to it. She's been doing this a long time. So that's my video on diabetes mellitus too.